Good afternoon, SHAPE community members. It's our pleasure to be with you today to answer your questions about the COVID-19 situation. I am Lieutenant General Brice Oudet. I am the Vice Chief of Staff, and here I will speak in the name of the Chief of Staff who is in Brussels today. Sadly, he wanted to be with you, but he cannot. I have with me Dr. Fazekas, who is our medical advisor here in SHAPE, and Colonel Raymond, who is the base support group commander, the mayor of our town here, of SHAPE village. Today is the World Day for washing your hands. I am absolutely serious. You can check the internet, this is for real. You have more than 400 World Day for any topics, but today is for washing your hands. And what they say is that you have to wash your hands for about 30 seconds when you want them to become COVID-free. And you can sing the chorus of the famous song by the Bee Gees, Staying Alive. And if you sing this, it lasts 29 seconds and your hands are good for COVID. Apart from this joke, I have to tell you that you all know that we are currently in a quite difficult situation because the COVID-19 figures are not good in Western Europe. The figures are ramping up, and you have to be conscious that the command group in SHAPE is monitoring very, very closely, and all the team is monitoring very, very closely those figures, and so that we can adapt and take appropriate measures. Those measures are aiming at two things. One is to protect your health, our health. This is the first motive behind our decision-making process. And the second one, which is very important, is about business continuity. We need to keep SHAPE up and running because as a strategic command, we give orders to soldiers, sailors, airmen, marines who are deployed on operation in Afghanistan, in Kosovo, at sea, in the air, and who put their lives at risk, and their lives depend on the quality of the orders we provide to them. This is why we cannot stop, and this is why we sometimes take tough decisions about the protective measures on COVID-19. Yesterday night, Admiral Rühle, the Chief of Staff, signed the third revision of the course order on COVID-19. What is new in this order is that, first of all, we have an important change in our policy. Prior to that, the decisions were based on a tier approach. So we man the headquarters at 50% or at 75% or at 90% or, if possible, 100%. We have changed from that, and now we have given autonomy and responsibility for the decision making at the ACOS and DCOS level. They are the ones who are in direct contact with their people, who have the knowledge of what's going on with the individuals and their families, and so they are the ones who can make the good decision about the manning, if people can do teleworking or not, if they work on classified network or not. So this is the main change in this order. What has not changed from previous order, and I go quickly on this, is that we still apply the strict rule of no travel on duty and no visit at SHAPE, with a very, very few exceptions for what is considered as being mission essential. But apart from that, this is the rule. The second point, you are probably well aware, because this is the Belgian law, is the rule of 4. For social events, you can be only 4 people for dinners or other events. Other than that, you have to keep the 2 meters distance and wear a mask. We apply part of the Belgian law. 90% of the rules we have here at SHAPE are fully compliant with the Belgian law, and 10% are somewhat more tough, stricter than the Belgian law, because there is this business continuity that I explained to you at the beginning of my brief. So you don't need to quarantine when you are coming back from amber zone, but you have to quarantine when you come back from red zones, except if you are a cross-border worker or if you stayed less than 48 hours in the red zone. What I have to say is that because the situation is deteriorating, we rely more and more on you, on your personal and responsible behavior. You need to be aware of what the rules are. You can ask us questions. We will always answer through the appropriate channels, be it the chain of command, be it the website. You have possibility to ask questions on the forum, no problem. Ask questions, we will give you the answers. But we rely on you. You have to have a personal and individual behavior which uses the knowledge of the rules and common sense. You probably know that we are having more and more cases here inside SHAPE, with more and more contact suspects. So I really rely on you to help me and to help us collectively come to hands with this. And I thank you for your attention as of now, and now we will start the question and answer session. Thank you.
Thank you very much indeed, sir. Good afternoon, ladies and gentlemen. Paul Dodds, SHAPE Public Affairs. Delighted to moderate the town hall today. Thank you for your questions that you've already posted. Please do engage with your live questions as well online today. You've already met our panel. Thank you very much indeed, sir. And just to introduce a couple of other people, off stage, Mr. Bayer from the Office of Legal Affairs. We've also got Lieutenant Colonel Smith from the SHAPE Healthcare Facility and Lieutenant Commander Clark from the SHAPE Morale and Welfare. Dr. Fazikaz will now give us an update on our influenza campaign following his terrific presentation on AFN this morning on the same subject.
Thank you very much, and good afternoon everybody, good afternoon Shapians, and thank you for the question. I explained already last time that I consider the influenza vaccination campaign of this year very crucial in our COVID-related efforts in order to exclude the influenza from the game, in order to eliminate at all the influenza. And in order to do that, we expect a big number of people volunteering for the vaccination, and we started the information campaign about that. And having said that, I would like to press the information that in November we will have a number of vaccination events, and everybody I encourage to take the vaccination against the influenza. It will not protect you against the COVID, but it will exclude this tricky period when you are suffering from influenza-like symptoms, to avoid this unstable situation if you are not aware if it is COVID or influenza. And by the way, it would be very unlucky if you acquire in the same time the influenza virus and the COVID virus, because then the outcome of the COVID would be very unpredictable. And I would like to use this opportunity, since I have Colonel Smith from the SHAPE Healthcare Facility to assist me with the influenza vaccination campaign issues from the SHAPE Healthcare Facility point of view.
Thank you so much, and hi to everyone out there. I bring you greetings from the SHAPE Healthcare Facility Commander Colonel Spangler and the entire command team. I'm Lieutenant Colonel Smith. I'm the Chief of Preventive Medicine at the Ship Healthcare Facility and also the Public Health Emergency Officer for Ship and the Benelux community. Concerning the influenza vaccine, we have just completed the entire planning of the influenza vaccine, as the doc just said. We're going to be posting them next week, latest on Monday, on what the schedule going to look like. We have series of events for the community because we want to encourage everyone. Based on just what the doctor said, we are living in a strange time, and we want to encourage everyone to come and get an influenza vaccine. We have worked with JMed. We have put a robust schedule together, community event together, and we want for everyone to come and get the influenza vaccine. It will be posted on the SHIP website and also on our website, the SHIP Healthcare Facility website. Before I say, let me just make quick points, because I know the last time some people were asking me a question. There's a change now in our Green Giant, the COVID clinic at SHIP Healthcare Facility. So we used to open from 08 to 4 p.m. Now we have cut it down due to manpower from 08 to 12. So from 08 to 12, if you are sick, you're having any kind of symptoms or anything, you can walk in and get tested, and get evaluated. However, if you want to call, you can call the COVID hotline. You can go on the SHIP website. We also have it on our SHIP Healthcare Facility website. You can call the regular line, COVID line, and after our line, we also have an after our line 24/7. You can also call the line. If you need dental pre-procedures, you can come to the Green Giant or the COVID clinic from 08 to 09. We are open if you have dental pre-procedures. And if you want any surveillance test done, or you just don't feel well and you want to do surveillance tests, it's from 9 to 12 noon, 09 to 12 noon. So these are the operation hours for our COVID clinic called the Green Giant. Thank you.
Well, thank you very much. This is a very valuable information, but there is here a point I would like to make. If you think you have symptoms of the COVID-19, you stay at home. Do not come to work. I know that the soldier mentality is go, 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 and we want to fulfill the mission. Here, sorry, but this is the bad attitude. I ask you to change your culture. If you feel symptoms, if you suspect you have symptoms, please stay home. Give a telephone call to the SHIP Healthcare Facility. They will give you the assessment and they will tell you when you can come and under what conditions you can come. But symptoms, stay home.
Thank you, sir. And also, thank you for also, Colonel Smith, just explaining that details will be published on the influenza jabs, because that's already addressed two of our questions today. One of them was quite specific on over 50s, but again, just to reiterate, the whole SHAPE community will have the opportunity to have the influenza jabs, so the opportunity. We live in dark times, and what we've done to try to cheer people up a little bit is we've reached out to the SHAPE families on Facebook pages for help from young Shapians regarding the influenza campaign, looking for creative posters. And just a short stop to say a big thanks to Catherine and Linda, who are both 9 years old, Justice, who's 5 years old, and Frederick, who's 13 years old, for your wonderful efforts. Please do look online on social media and you'll see those wonderful examples. So we've answered the question on the flu jab. So the next question, perhaps for BSG. On the last town hall, it seemed there was hope for the reopening of the chapel. Is there an update, please, when the SHAPE chapel will reopen and services can start again?
You take that, sir?
Yeah, of course.
Yeah, thank you. So that's a very timely question. As of yesterday, the Chief of Staff approved us reopening the chapel under certain conditions, and actually the chaplain, the International Staff Chaplain, is meeting with the chaplains from the various nations as we speak to conduct the training to make sure that all the services can be performed in accordance with the restrictions that the staff has presented to the Chief of Staff. It's important to realize that, we open the gym, that takes care of one part of the person, but the whole person is what we're trying to get after, the health and well-being. And while we're trying to protect people against the virus, we also need to provide for their well-being. And your leadership here understands that, and we're trying to work as safely and as quickly as we can to provide whatever opportunities we feel that we can safely implement.
Thank you, sir. Perhaps a question for our VCOS again. I think you did touch on this, sir, at the beginning, so maybe just to re-emphasise for some people who've joined us a little bit late. According to the Diplomatic Belgium website, which is on your screen, ladies and gentlemen, the host nation does not insist on quarantine when returning from amber zones. Are Shapians still mandated to quarantine 14 days when returning from amber zones?
No. This decision was in appliance before, and it has been removed from the orders given by our Chief of Staff. So now, when you come back from an amber zone, it is not mandatory, according to SHAPE regulation, it is not mandatory to quarantine. Nevertheless, I ask here for your common sense. If you think you are coming from a zone at risk, you can make the self-decision to protect yourself and protect others. Okay, so even if it's not mandatory, you might have good reason not to socialize with other people as you do normally. Okay, again, which we said in the beginning, is that we are in a dire situation. The situation has deteriorated. So the more caution you take, the better we collectively are.
Thank you very much, sir, for making it absolutely clear. The next question then, and I think we'll open this to the floor because may be different views on this one or different ways of addressing the answer. Why does SHAPE insist on longer quarantine periods when travelling from red zones than the host nation, i.e. 14 days for Shapians when it's only 7 days for Belgian personnel?
Yeah, this is a very good question, and I know it has been asked a lot. There are two reasons for that. One is operational, the other one is medical. I will answer to the operational part, and Dr. Fazekas will answer to the medical part. The operational reason is that the more we quarantine, the less risk we take to have a mandatory reducing in our manning due to contact cases. And again, I come back to business continuity. We are not a car factory. We are a strategic command with real life operations. So we need to have the maximum staffing as possible to release smart and relevant orders. But of course, there are also medical reasons for that, Doctor.
Thank you, sir. And just to explain the situation within the, for it, I mean, we stick to an incubation period of the COVID-19 disease, which is up to 14 days in many cases. And that determines the length of the required isolation from the community, from the colleagues at work at SHAPE, finally, in order to protect everybody's health and to ensure the operation of the headquarters. And these 2 weeks we had a strong look into the scientific literature and latest publications. It has not been changed. As a result, it's my very strong medical recommendation to the command group to keep the mandatory isolation period, which we now call differently. We call it restricted access to SHAPE, 14 days, because it must equal to the incubation period of the disease. And you can see a slide in my video posted on the YouTube, and thank you Comdiv to support me with this video, and I am giving there a visual explanation of this 2-week incubation period, and I am really sorry that it did not change to 7 days, because I feel also a big push, but since the incubation period is 14 days, we restrict the access and we perform the 14-day isolation as a consequence.
Yeah, and what you have to understand is that the 7 days quarantine period, this is a decision made by the Belgian government for political reasons. You need to strike a balance between protecting your population from the disease in a good manner, but also keep the economy running. And keep the economy running is not just to make money. It's because you have people, if they don't work, they don't have a salary. If they don't have a salary, it's a total disaster for them. So you need to have people at work simply to live properly. So this is why the governments, and from one country to the other, it's not exactly the same regulations. And the governments have to make tough decisions. And here, inside Belgium, we have to make those decisions compared to what is our professional output. And again, our professional output is operations.
Thank you very much indeed, sir. So you've got the Shape Today website on the screen there. If you dive into that, you'll eventually get to Shape Sports and Fitness. And this is where the next question's coming from, congratulating Base Support Group with their new online booking system. I've used it personally. It's great. And I've enjoyed my swim. Thank you very much. The worry here is that some of the classes have opened, and with the question is really grateful for that. But are we expecting them to start closing down again because of the increases in COVID?
Yeah. Well, I think what I would say about that is about a month ago, we opened those facilities back up with great confidence. Confidence in the measures that we put in place were sufficient to provide a degree of protection against the spreading of the virus, and confidence in the professionalism of our community to follow those rules and not try to find a way around them or to quickly slip into lazy protocols. We've been very fortunate. I go through there regularly. Other leaders go through there regularly, and I consistently see good adherence to the behavior that we requested people to respect. So I've been very, very thankful and hope to continue those services, to provide those services in the future. I hesitate to make a prediction. None of us know what's going on, but I can say that we're committed to providing whatever services to this community that we can safely provide, and I just don't have any more future insight than that.
Yeah, from where I sat by the side of the pool the other day, the staff are doing a tremendous job. They're applying the standards strictly. All the people I saw respect the staff, and they understand why we're doing it, and let's carry on with that good behaviour.
Help us continue.
Yes, absolutely, sir, yeah. So for the medical team, can you give us any top tips, please, for preventing catching the virus, including the latest advice on masks?
Yeah, and thank you for the question. It's really important that we don't lose our focus. We keep focused on preventing the viral transmission of the COVID-19, and we keep these simple preventive measures in doing every day continuously and in a stubborn way. I am quite stubborn, but that helps because the virus is stubborn also. So the pandemic is not releasing us at this moment. So what we are required to do to keep the 2 meters of physical distance. If we cannot keep the 2 meters physical distance, we must wear the mouth and the nose cover, as legally said, the mask. And especially in every environment, we should have the mask with us, like I have with me, you should have with you. And when you don't need, you cannot maintain the 2 meters, please put it on. Also, I recommend for children to use the mask in the school environment. We had a case from the school also, so it is important that we prevent the virus transmission within the children as well. Plus, we disinfect our hands, as General Udet said. It's not only on the day of the hand washing, but every day we wash frequently and we disinfect. We also check the literature. The 70% alcohol content disinfectants kills the virus of COVID-19 within 15 seconds. And it takes just such a short move. So we keep disinfect our hands, we keep disinfect the surfaces around ourselves. When we come into a new room, we disinfect the surface. When we leave, we disinfect. And I recommend to do it at home as well. And as Jean Oudet said, if anyone experiences any common cold-like symptoms, we stay at home, we give a phone call to the hotline, as my dear colleague mentioned, Lieutenant Colonel Smith, to the SHAPE healthcare facility, and we clear the situation if we suffer from COVID or not. And that's inevitable. And by the way, beside all this, we get ready to get the influenza shot. As I said already, we need to exclude the influenza from the game, and that will help me and my colleagues in the SHAPE healthcare facility. But it will help you also to avoid any kind of uncertain period when you are mentally really hit by a fact that you don't know if you suffer from influenza or COVID.
Thank you, sir. So the time is not to be complacent. And I give you my word, gentlemen on the panel, I personally cleaned your table today with disinfectant. And my wife would give you a top tip as well, not just to our panel, but to everybody. She's quite fastidious. She sprays down the shopping when it comes in and wipes it all down. Sometimes it gets a little bit wet, but it does the job. So we've seen evidence in the shops that Christmas is coming. Is it going to be any different as SHAPE this year? Are we going to see the national Christmas markets that bring SHAPE alive at that time of the year, or perhaps not?
I can start, and probably Ryan, you can follow on. What you have to know is that the command group is perfectly aware that the Christmas period is coming. And with Christmas market, Christmas activities, and also Christmas leave. As of now, no decision has been made on what is going to happen. This virus is not evolving in a rational manner. When everything is 100% rational, you can almost predict the future. But with this virus, there is still today lots of unknowns about the virus, and it's very difficult to predict the future. So chiefs of staff will make decisions in the relevant time frame so that people can plan enough in advance, but not too early, because we want to have the last valid update on how the virus is evolving. So we will probably reach some decisions at the end of the month. I cannot be more accurate than that, but I really want to reassure you that this is absolutely under consideration at the highest level of command here in SHAPE. Yeah, right.
Yeah, sir, I agree. I don't think there's any question this Christmas is going to be different than last year and the years previous. How different and in what ways, we're not in a position to say yet. The staff is working to see what we can provide safely for communities, because community events are important part of a healthy community. So we're looking to ensure that we can do something to make sure the strength of this community stays together. But we have to do so safely, and as the Vice Cost just said, with valid, relevant information, and we don't have that information quite yet.
Thank you, sir. Question from medical colleagues again, please. And this is our first live question today, although we've answered a couple in the beginning. Who can get COVID tested within the SHAPE healthcare facility?
I could answer on this question, but I would hand it over to my SHAPE healthcare facility colleague.
Well, once you're at NATO, this is Lieutenant Colonel Smith again. If you work at NATO and you're U.S. soldier or U.S. service member dependent, you can call the hotline or you can come to the COVID clinic and we evaluate you, and if you need a test, we're going to give you the test.
Hey, Colonel Smith, that's all U.S. personnel plus all internationals who work on SHAPE?
All U.S. personnel, all U.S. NATO national who work on SHAPE can get a test at the COVID clinic.
All nations, okay.
All
Thank
nations.
you.
That's reassuring for everybody. The next one's a tricky one, I think, but we've covered it in a previous town hall, but let's do it again. This caller is struggling with the logic behind allowing cross-border workers commuting to and from red areas whilst people can't go back on their holidays to their own house without quarantining. So,
yeah, okay. Again, this virus is not 100% rational. So what we do is we take measures to reduce the risk. We cannot have a zero risk, we cannot have a one-size-fits-all solution, but what we do is that we take measures for reducing the risk. And some of those measures might appear not being fully rational. This is true. I admit it. Some of the decisions we make are not only based on rational facts. So if you want to put all the decision in a well-squared box, no, this is not the way it goes, because this is not the way the virus goes. So you have some exceptions for the quarantine coming from the red zones if you are cross-border, including weekly cross-border or regular cross-border. If you go to your main residency where your family is, be it away and not just 1 or 2 borders away, that's okay. But we try to do our best to minimize the risk, not to eliminate the risk. It's impossible.
thank you, sir. Our next question, again, it's one that's been repeated, but it should be asked because it's live, for BSG. Any news on the library opening, please?
That's something that we're considering right now and looking for to what scale we can reopen the library services and which services within the library are appropriate to reopen. You know, probably having, you know, a Barnes & Noble scenario where people are sitting around lounging and enjoying the afternoon is not feasible. But providing access to hard copy materials is something that we're striving to ensure that we have the right measures in place for. So stay tuned. I think we'll be able to pursue a decision on that relatively shortly.
And our final question today, you've touched on it, sir, already. So before we do that, I think Colonel Smith just got something to add to that. So before our final question.
I just want to clarify on the question concerning who can get tested. I want to make the clarity here right now. If you travel on leisure, you want to visit other countries and it's not mission, we're not going to provide you the test because we're keeping the test for mission essential people. So if you work with NATO and you are going on mission, NATO mission, we test you. If you are symptomatic for any reason and you have to get evaluated, we will test you. If you're to the school teacher, we will test you. But we're not going to test people who just go leisure, come back. If you go on leisure, you come back, you have to go get tested on the economy because we only keeping those tests for our NATO mission essential people and those who need a test because we just can't test everyone who just go on leisure and come back. I just want to make that clarification.
Thank you very much indeed. So again, the final question, you've addressed it already, sir, really, but we'll ask it because it's live. Why not go back to the tiered system of 25 or 50%?
Yeah, okay, thank you very much. Because as I said, you would downsize part of the headquarters where people need classified networks and cannot work from home, which means that this part of the headquarters will have lower input and the job is not done. But maybe in this part of the headquarters there is no reason why you should downsize because nobody is a positive case, there is no contacts, nothing. In another field, like public affairs, for example, you can easily work from home because you work mostly on unprotected networks. So this is why Admiral Rulle made the decision to have this more on a case-by-case basis, which is really more fit to the current situation than having a kind of one-size-fits-all solution with the tiered approach.
Thank you, sir. I suppose you can imagine for some of the families at home who've not ever been in the headquarters, it's all a bit of a mystery, really. These are really good questions. Thank you for asking them today. Thank you to our panel and our guys behind the scenes, including our production team, who make this all possible for you. But the biggest thanks, again, to you, our audience. You've stayed with us today. We've noted that, and we're really grateful for your interaction. Please follow the links on the screen. Do ask questions on the helpline if you get stuck, and just be sensible and safe. So now I'll hand back over to your Vice Chief of Staff, General Houdet, for his parting words.
Yeah, thank you very much, Paul. Just to conclude, I do not like this situation. I'm like you. I haven't seen most of my children and grandchildren for months now. I feel a kind of prison life. It's not pleasant. Sadly, it is going to last. We have to be resilient in this hardship that we are going through. And collectively, we really need everyone and each of you to have a responsible behavior and to abide by the health protective measures to avoid the spreading of the virus and be staying alive.